Hi everybody, my name is Becca Hargis and I'm an author for the Dissociative Living blog at HealthyPlace.com. I just want to say first that there is a trigger warning to this video for discussion of eating disorders, self-harm, and suicidal ideation. So if you find yourself vulnerable to these topics, please go ahead and stop the video now. Thank you. I wanted to come today and share with you some thoughts that I'm having about treatment expectations. And I want to share something very personal with you about myself and why I think it's important for you to know. It's always my goal when I write an article, a blog post for HealthyPlace, to leave you with some positivity and some hope. I've written before about opposite gendered alters, how to communicate with your alters, and I've even discussed the 5 positive benefits of having DID. But I don't want to be dishonest with you and think that everything is just great. Recently I've had a setback, and for the past 5 or so months I've been dealing with chronic depression that is treatment resistant, so it's not responding to medication. I've also had suicidal thoughts and ideations. No plans or actions or attempts, but the thoughts are there. I've self-harmed on occasion, more often than I would like to admit. And I've also had a relapse with my eating disorder, and I've been to treatment, residential treatment, twice in the last year. I share these things with you. I'm not ashamed of them, but I want you to know that treatment is not linear. And it is true that I've been in treatment for 28 years, and 24 of those years have been for DID. In fact, someone was mentioning or talking to me the other day, and they said, if you've been in therapy for 24 years, why are you still having suicidal ideations? And my response, guys, is that recovery, as you know, is not linear. It is all over the map. Sometimes we're up and sometimes we're down. And even after 24 years of solid therapy, I still fall prey to some of those old coping mechanisms that I've worked so hard to get past. And just because I'm an author and have been in therapy for 28 years for DID, it doesn't mean that I'm exempt from challenges or from struggles. But I always want to leave you with something positive and something hopeful. Recovery is possible. Therapy does work. And there is hope. And I know that as low as I feel and as much as I'm struggling right now, I'm still better off and in a better place than I was when I first started. So even though I'm struggling, there's still positive things to look for and to look at. So please stay with me on this journey, and until then, I will keep writing and keep posting and keep hoping. Thanks, guys.